Nobody in that emergency room had seen wounds like that before. Not the attending physician with 22 years of trauma experience, not the senior residents, not the nurses who had worked 3 wars' worth of disaster drills. The lacerations were precise, geometric, arranged in a pattern that made no biological sense, and the patient, a man with no ID, no history, no name, was dying. Fast. Then the doors opened. 4 men in dark suits walked in, and one of them said 4 words that turned that ER into a crime scene. Nobody leaves this room. Dr. Lena Vasquez had been awake for 31 hours when the ambulance bay doors exploded open. She was on her 3rd cup of cold coffee, standing at the nurses' station in the basement trauma wing of Hargrove Medical Center in Baltimore, reviewing discharge paperwork on a 17-year-old with a broken collarbone. Nothing glamorous, nothing exciting, just the slow, grinding machinery of an overnight shift on a Tuesday in November. Lena was 43 years old. She had dark circles under her eyes that no amount of sleep seemed to fix anymore. Her ID badge said, Dr. L. Vasquez, Trauma Consulting. Consulting. That word carried weight she tried not to think about. 2 years ago, she had been the head of trauma surgery at one of the most respected teaching hospitals on the East Coast, the youngest department chief they had ever appointed, the one everyone pointed to when they wanted to show what excellence looked like. Now she was here. Basement level, consulting, filing paperwork at 3 in the morning while the real surgeons worked upstairs. Her colleagues were polite about it, most of them. Dr. Harlan Briggs, the current chief of trauma, was less polite. He was 58 years old, silver-haired, and carried himself like a man who had never once in his life questioned whether he belonged in any room he walked into. He had made it clear during Lena's first week at Hargrove that he considered her presence a liability. Not in those words. Men like Briggs never used those words, but he said it with the cases he assigned her, the paperwork, the consults on non-critical patients, the way he smiled when he introduced her to visiting physicians as our consulting specialist, like she was a piece of furniture he had inherited and didn't know where to put. 2 months earlier, he had pulled her aside after a staff meeting and said, with genuine puzzlement in his voice, that he wasn't sure Hargrove was the right fit for someone with her particular history. She had smiled, nodded, said nothing. Because what was there to say? She knew what her history was. She didn't need Harlan Briggs to remind her, but none of that mattered at 3:17 in the morning when the paramedics came through those doors, moving faster than she had seen anyone move in months. There were 2 of them, a man and a woman, both breathing hard, both with expressions on their faces that Lena recognized immediately. She had worn that expression herself more times than she could count. It was the expression of someone who had seen something they couldn't explain and were desperately hoping someone smarter than them could fix it. The gurney hit the trauma bay doors, and Lena was already moving. Not because anyone called her, not because it was her assigned bay, but because her body moved before her brain could stop it. 31 hours of fatigue and 2 years of suppressed instinct burned off in about 3 seconds flat. The patient was a white male. She estimated mid-40s, athletic build, approximately 190 pounds. He was unconscious. His blood pressure, per the paramedic report, had been 80/50 in the field and dropping. His pulse was rapid and thready. He was pale in the particular way that tells you the body is rerouting everything to the core, abandoning the periphery, trying to stay alive 1 minute at a time. But it was the wounds that stopped her. She had her gloves on before the gurney came to a halt, and she was already cutting away the shirt when she saw them. Her hands went still for exactly 1 second. 1 second. Then they kept moving. Because that was what her hands did. They kept moving even when her brain was screaming. The lacerations were across his torso, 6 of them, arranged in 2 parallel diagonal rows of 3. Each wound was approximately 4 centimeters long, perfectly consistent in depth based on the bleeding pattern, with edges so clean they looked almost surgical. They were not from a blade. The geometry was wrong for any blade she knew. They were not from a projectile. There was no entry track, no fragmentation, no thermal signature. They were not from a puncture weapon. The width-to-depth ratio was unlike anything she had seen in 12 years of trauma surgery, and before that, 4 years as a forward surgical team member attached to the United States Army in 2 different combat theaters. She had seen people hurt in ways that most doctors couldn't imagine. Improvised explosives, high-velocity fragmentation, pressure injuries from blast concussive force, industrial accidents, vehicle extractions. She had worked on a soldier once whose wounds had been caused by a weaponized agricultural drone that no one was supposed to know existed, and even those wounds made more sense than what she was looking at right now. The pattern was deliberate. That much was obvious. Whatever had made these wounds had made them intentionally, and made them with precision that suggested either extraordinary technology or extraordinary control or both. And whoever this man was, he had no identification. The paramedics confirmed it. No wallet, no phone, no watch, no jewelry. His clothing had no labels. His fingerprints, when the admitting nurse attempted a quick scan with the hospital's standard ID system, returned no match in any accessible database. He was, for all administrative purposes, nobody. A nobody who was bleeding out on her trauma bay table. Dr. Nadia Ostrov, the third-year resident assigned to the overnight bay, appeared at Lena's elbow. Nadia was 29, sharp, well-trained, and currently looking at the wounds with an expression that was trying very hard to be clinical and not quite succeeding. "What is that?" Nadia said. It wasn't really a question. "I don't know yet," Lena said. "Get me a full panel. Type and cross for 6 units. Get imaging up here. I want chest and abdomen CT right now, and somebody get me an ultrasound because I need to know if he's bleeding into his chest cavity before we move him anywhere." "You're not assigned to this bay," Nadia said, not unkindly. More like a reflex. "Then page whoever is," Lena said, not looking up. "In the meantime, either help me or move." Nadia hesitated half a second. Then she was already reaching for the phone. Harlan Briggs arrived in the trauma bay 6 minutes later. He did not look pleased. He never looked pleased when he had to come down to the basement at 3 in the morning. But tonight, there was an extra layer of displeasure on his face that Lena recognized as specifically directed at her. "Who authorized you to run this bay?" he said. "Nobody," Lena said, not looking up from the ultrasound probe she was running along the patient's left lateral chest wall. "There was a patient," I responded. "This isn't your case, Vasquez." "He's got a hemothorax developing on the left side," she said. "Moderate volume, not yet tension, but if his pressure keeps dropping, we're going to need to decide in the next 8 minutes whether we're going to the OR or doing a bedside decompression. I'd recommend getting a thoracic surgeon down here." Briggs stared at her. She could feel it without looking. "The wounds," he said after a moment. "Yes," she said. A pause. "What made those?" "I don't know. I've never seen anything like them. Whatever it was precise, it was powerful, and it was not any commercially available or military standard weapon system I have personal knowledge of." She finally looked up at him. "Which is saying something." Briggs opened his mouth to respond. He didn't get the chance, because that was when the doors opened. There were 4 of them, 3 men and 1 woman. They were wearing dark suits, not scrubs, not hospital administration attire, suits. The woman was in her late 30s, with a posture that communicated authority so efficiently it was almost architectural. The men ranged from early 40s to late 50s. None of them were wearing visitor badges. None of them had been stopped at the desk, which meant they had credentials that bypassed the desk entirely, or they had simply walked past it with such absolute confidence that no one had thought to question them. The woman stepped forward. She looked at Briggs. Then she looked at the patient. Then, with a brief pause that felt longer than it was, she looked at Lena. "This room is now a restricted access zone," she said. Her voice was calm. Completely, extraordinarily calm, in the way that people are calm when they are used to saying things that change rooms. "All non-essential personnel will exit immediately. Essential personnel will be identified and credentialed in the next 60 seconds. No patient information, imaging, or physical evidence leaves this room without authorization from my office." Briggs drew himself up to his full height. He had a very good full height. "I am the chief of trauma at this hospital, and I need to know who you are and by what authority." "Dr. Briggs," the woman said. She hadn't checked a file. She already knew his name. "Your cooperation is appreciated and expected. This patient falls under a federal jurisdiction I'm not at liberty to detail. You will, of course, be fully briefed through appropriate channels." She looked at him with eyes that made it very clear that the briefing would happen on her timeline, not his. "Step out, please." Briggs stepped out. Lena watched this happen and kept her hands exactly where they were, on the patient, on the ultrasound probe. Because whatever was happening in this room, the man on the table still had a hemothorax and a heart rate of 110 and a blood pressure that had ticked down another 4 points in the last 2 minutes. The woman in the suit looked at her. "Dr. Vasquez, you're staying." Lena looked up. "How do you know my name?" "We know quite a lot about you," the woman said, and then she did something unexpected. She said, "That's actually why we're here." The next hour was the strangest of Lena Vasquez's professional life, and she had spent 6 months attached to a forward surgical unit in a place whose name she still wasn't allowed to say out loud in public. The woman's name, as far as Lena was permitted to know it, was Agent Calloway. She did not specify which agency. She showed a credential that Lena looked at for 2 seconds before deciding she wasn't going to push. The men with her were introduced only functionally. The tall one was a medic. The older one was a physician, a Dr. Stern, who came to stand at the bedside and look at the patient with the focused intensity of someone who had been looking for this specific man for a very specific amount of time. "Is he going to survive?" Stern said. "That depends on the next 30 minutes, Lena said. "He needs the hemothorax addressed. He also needs someone to explain to me what made these wounds, because the treatment protocol for a wound channel I don't understand is a wound channel I might inadvertently make worse." Stern looked at Calloway. Something passed between them. "The wounds were made by a directed energy system," Stern said. "Prototype, not publicly documented. High-frequency focused acoustic pulse modulated to penetrate soft tissue at a specific resonance. It's designed to incapacitate without leaving ballistic evidence." Lena looked at the wounds again. The geometry, the precision, the clean edges. That explained the pattern. Acoustic focusing would create exactly that kind of wound topology if the emitter array had a hexagonal configuration. "Is there a thermal component?" she said. Stern blinked. "Yes, low grade. How did you—" "Because the tissue margins aren't just cut," she said. "They're slightly desiccated. I thought it was an artifact. It's not." She was already thinking through the implications. Desiccated margins meant compromised healing response. Standard closure protocols would hold short-term but risk dehiscence within 48 hours. She needed to adjust her approach. "Can you work with that information?" Calloway said. "Yes," Lena said. "I need the room set up for a chest decompression, possible thoracostomy. I need my resident back in here. I need the specific pulse frequency if you have it, because that will tell me how deep the acoustic damage extends beyond the visible wound margin." Calloway looked at her for a moment. Then, 7.4 kilohertz modulated pulse. Lena nodded, did the math, looked at the wounds again, adjusted her mental map of the tissue damage profile. "All right," she said, "let's keep him alive." She worked for the next 2 hours and 14 minutes without stopping. Nadia came back in and worked alongside her, asking questions and taking instructions with the focused precision of a resident who understood that something unusual was happening and had decided that the best response was to be so competent that no one could justify sending her away. Lena respected that. She had been that resident once, in a different world. The hemothorax required a thoracostomy tube, which Lena placed with a speed and surety that made Nadia go slightly quiet. Not because it was complicated, because it wasn't. Because Lena moved through it the way you move through something you have done so many times that it no longer requires conscious thought. Her hands remembered things her brain had tried to set aside. The wounds themselves were the harder problem. She worked through them methodically, accounting for the acoustic damage margin that extended beyond the visible tissue disruption, using a closure technique she had developed herself during her time in the field, where you frequently had to treat wounds that had been made by things no medical textbook had ever described. She had written a paper about it once. The paper had been classified before it could be published. Stern stood at the periphery and watched. He said nothing for most of it, but Lena caught him twice, making notes on a tablet he carried, and both times he was looking at her hands. The patient's blood pressure stabilized at 94/62 at the 1-hour mark. At the hour 40 mark, it was 102/68. At 2 hours, it was 112/74, and his heart rate had come down to 88. His color was returning. His oxygen saturation, which had been at 89 when he came in, was sitting comfortably at 97. He was going to live. Lena stepped back from the table, pulled off her outer gloves, looked at the monitors for a long moment. Calloway was standing to her left. Nicely done, she said. Don't, Lena said quietly. Calloway tilted her head. Don't compliment me like I did something unusual, Lena said. I did my job. That's all I've ever done. A silence settled over the room. The monitors beeped, steady now, rhythmic, the sound of a body that had decided to keep going. We need to talk about you, Calloway said. I know, Lena said. But first, tell me who he is. Calloway considered this for a moment. His name is Garrett. He's one of ours. He was extracted from a facility in Eastern Europe 48 hours ago. The weapon used on him was captured technology we've been trying to understand for 18 months. He was exposed in the field as part of a controlled assessment. She paused. That's as much as I can tell you. Was it voluntary? Lena said. His exposure. A very brief pause. Yes. Lena looked at the man on the table. Garrett. He had a strong jaw and calloused hands, and a scar along his left forearm that she recognized as a specific type of surgical repair, the kind done under field conditions without adequate instruments. Someone had saved his life before, in circumstances that were not designed for saving lives. He'd kept going anyway. She understood that more than she wanted to. You said you know about me, Lena said. We do, Calloway said. We've known about you for longer than you might be comfortable with. Your record at Johns Hopkins, your surgical outcomes, your publication record, including the ones that were never published. She said that last part evenly, without emphasis, but the emphasis was there. And we know about Kandahar. The word landed in the room like something physical. Lena didn't move, didn't flinch. She had worked very hard on not flinching. Kandahar, 2017. A forward operating base and a night that had started as a routine surgical support rotation and had become something that didn't have a word for it in any field manual she had ever read. 14 casualties in 4 hours. One surgeon. Her. A team of medics who were exceptional at keeping people alive long enough to reach her, and a situation that kept producing patients faster than any normal calculus of survival should have allowed. She had saved 11 of the 14. In those conditions, with those resources, in those hours. 3 had died, and those 3 had lived in her chest ever since, in the specific way that losses live in you when you have done everything right and the outcome was still wrong. When the variables that killed them were outside your control, but your hands were the last hands that touched them, and so some part of you will always carry the question of whether there was one more thing, one different move, one choice you didn't see. She had come home from Kandahar and thrown herself into her career with a ferocity that frightened people who didn't understand it. The research, the innovations, the techniques that were called groundbreaking by people who had no idea where the ground had been broken. She had climbed to department chief at 39, and then, 18 months ago, something had come apart. Not a scandal, not a failure. Something quieter and more total than that. A patient she couldn't save. A night where the variables were inside her control and the outcome was still wrong. And this time, she couldn't build a wall between herself and the question. She had taken a leave of absence. The leave had become a demotion, gentle and institutional, arranged by people who cared about her and had no idea what to do with her. And she had ended up here. Basement level, consulting, filing paperwork at 3 a.m, trying to be smaller than she was. Kandahar's classified, she said. Yes, Calloway said. Everything that matters usually is. She took a breath. Dr. Vasquez, what happened to you 18 months ago? We know about that too. We know it wasn't a competence failure. We know what it was. And I want you to hear me when I tell you that the people I work for have been watching your trajectory for 4 years, and what happened 18 months ago did not change what we see when we look at you. Lena said nothing. What we see, Calloway continued, is the most effective field-capable trauma surgeon we have ever evaluated. Someone who can work in impossible conditions with unknown variables and produce outcomes that should not be statistically possible. Someone who, tonight, correctly identified wound characteristics from a weapon system that does not officially exist, adjusted her treatment protocol in real time based on information she derived herself before we told her anything, and saved the life of an asset we have spent considerable resources protecting. She paused. We have a program. It's called something I'm not going to tell you tonight. What I will tell you is that it places surgical teams in situations where the variables are always unknown and the margin for error is always zero. And we've been short a lead surgeon for 7 months. The room was very quiet. You're offering me a job, Lena said. I'm telling you that there's a place where what you are is not a liability, Calloway said, where it's the entire point. Stern spoke for the first time in an hour. He had put down his tablet. He was looking at her directly. Dr. Vasquez, I've watched 8 surgeons attempt what you did tonight in various training scenarios. 2 of them came close. None of them got there. You got there without knowing what you were dealing with, without backup, on 31 hours of no sleep in a basement. He shook his head slightly. I owe you an apology. We should have approached you a year ago. We waited too long. Lena looked at him, then at Calloway, then at the man on the table, Garrett, whose blood pressure was holding and whose color was good, and who would wake up in a few hours not knowing that the person who kept him alive was a surgeon that her own hospital had filed away in a basement, because no one knew what to do with someone who had seen too much and still kept showing up. She thought about Briggs, about the paperwork, about the word consulting on her badge, about the cold coffee and the 31 hours and the way her hands had moved tonight, certain and precise, like they had never stopped being exactly what they were. She thought about Kandahar, about the 3 she had lost, about the 11 she had saved, and whether she had ever properly let herself count those. She thought about what it meant to be good at something that cost you everything, and whether the cost was the point or whether the cost was just the price, and whether those were the same thing. Tell me about the program, she said. Calloway almost smiled. Almost. Not tonight. Tonight you finish your shift. You go home. You sleep. She reached into her jacket and placed a card on the edge of the supply table. Plain white, a phone number, nothing else. When you're ready. She looked at Lena one more time. And there was something in that look that Lena had not seen, directed at her in a very long time. Not sympathy, not pity, not the careful professional concern of colleagues who were worried about her trajectory. Recognition. The kind that passes between people who have both stood in rooms where the margin was zero and kept their hands moving anyway. Then Calloway nodded to her team, and the men in suits gathered themselves with quiet efficiency. Stern paused at the door and turned back. The paper you wrote, he said, the closure technique, the classified one. He tilted his head slightly. It works. We've been using a version of it for 3 years. We just didn't know it was yours until tonight. He looked at her for a moment longer. It should have been published. Then he was gone. They were all gone. The room was just a room again. Monitors, lights, the steady sound of a man breathing who had not been breathing steadily 2 hours ago. Nadia stood at the far end of the bay, pretending to chart. She had heard everything. Lena knew she had heard everything. She looked up, met Lena's eyes, and for a moment neither of them said anything. Then Nadia said, very quietly, 7.4 kilohertz. How did you know that mattered? Because the tissue told me, Lena said. You look at the wound and the wound tells you what made it, if you know how to listen. Nadia nodded slowly, like she was filing that away somewhere she intended to keep it. Lena picked up the white card from the supply table, looked at it, turned it over. The back was blank. She put it in the pocket of her scrub top next to the reading glasses she kept losing. She went back to the nurse's station. There was still paperwork. There was still a cold cup of coffee. There were still 6 hours left in her shift. She sat down, picked up a pen, and for the first time in 18 months, something in her chest that had been clenched like a fist began, very slowly, to open. She didn't call the number that morning. She didn't call it that afternoon either. She slept for 9 hours in her apartment with the blinds down and the phone on silent. And when she woke up, she sat in the kitchen and made actual coffee, real coffee, in a pot. And she thought about Garrett's blood pressure, holding at 112/74. She thought about Stern's face when he watched her work. She thought about Calloway's word, recognition. She called on the 3rd day. Calloway picked up on the 2nd ring, like she had been expecting it, like she knew exactly what 3 days meant. I have questions, Lena said. You'll have answers, Calloway said. Most of them. The ones I won't have answers to. You'll learn to live with those, Calloway said. You already know how. A silence on the line. The particular silence of two people who understand each other. When do I start? Lena said. 6 months later, Dr. Harlan Briggs received a letter from a federal office whose letterhead he did not recognize. It informed him, in the precise language of institutional bureaucracy, that Dr. L. Vasquez had accepted a position with a specialized medical unit operating under federal jurisdiction and would no longer be available for consulting duties at Hargrove Medical Center. It thanked him for providing a professional environment during her transitional period. Briggs read the letter twice. Then he looked at the framed photograph on his desk, the one of his department from 4 years earlier, before Vasquez had left for wherever it was she had gone, before she came back different. He thought about the night 3 nurses had told him about in the basement trauma bay, when a man with wounds nobody recognized came in, and she had handled it like she was reading a map she had memorized. He thought about the word consulting on her badge and felt for the first time something he didn't have a comfortable name for. It might have been shame. He put the letter in a drawer, went back to his day, did not think about it again, or told himself he didn't. Garrett, whose last name remained classified, was discharged from a facility that was not Hargrove Medical Center approximately 3 weeks after the night Lena saved his life. He had been told very little about the circumstances of his survival. He had been told only that a surgeon had been there, and that the surgeon was exceptional, and that he owed his life to someone who knew how to listen to what a wound was saying. He asked, once, for a name. He was told it was classified. He laughed at that. A real laugh, the kind that costs you something when you've got healing ribs and a chest tube site that's still tender. Then he said, to no one in particular, that he hoped whoever she was, she knew that it mattered. What she had done, that it mattered. She knew. She was 6,000 miles away on a transport aircraft with no commercial designation, reviewing patient files on a tablet with no civilian network access, preparing for an operation in a location she was not allowed to name, with a team of medics who had all worked in places that didn't appear on any map the public could read. She was the lead surgeon. Her hands were steady. They had always been steady. She just hadn't had anywhere worthy of them for a while. She looked out the small porthole window at the darkness below the aircraft. Somewhere down there were people who needed someone who could work when the variables were unknown and the margin was 0. Someone who had learned, in a forward operating base in the dark, that the difference between possible and impossible was usually just the willingness to keep your hands moving. She had learned that. She had paid for that knowledge in a currency that doesn't appear in any budget. And now she was spending it. Every day. In rooms that didn't officially exist, saving people whose names she would never know, doing exactly what she was built to do. There is something this story keeps asking, quietly, underneath all the urgency and the sealed doors and the wounds that shouldn't exist. It asks what we do with people who have been shaped by experiences too difficult to explain. The ones who come back from the hardest places, changed in ways that make ordinary rooms feel too small. We often don't know what to do with them. We file them away. We give them the word consulting on a badge and hope they'll be content with paperwork at 3 a.m. We look at the damage and miss the capability that grew directly out of it. Lena Vasquez did not become exceptional despite Kandahar. She became exceptional because of everything she carried through it and out the other side. Her losses made her precise, her survival made her fearless, and the years of being underestimated gave her something that no training program can manufacture. The absolute, bedrock certainty that she didn't need anyone to tell her who she was. She already knew. The people who have been through the hardest things often carry the most useful knowledge, not in spite of what broke them, but because of how they were rebuilt. Never write off someone who is quieter than their abilities. Never assume that a smaller title means a smaller person. And never, not ever, mistake stillness for emptiness. Sometimes the most dangerous person in the room is the one in the basement, filing paperwork, waiting for the moment when their hands are needed. If this story got under your skin the way we hoped it would, share it with someone who needs to be reminded that their past doesn't disqualify them. It prepares them. Drop a comment below and tell us, Have you ever been underestimated by someone who later had to watch you prove them completely wrong? We want to hear it. And if you want more stories like this one, stories about the people who show up when everything is on the line and the room has been sealed and nobody knows what's coming except the one person everyone overlooked, then subscribe. Because we have more, and every single one of them is worth your time.